Have you ever wondered what it would take to make a doctor completely rethink everything that he or she was taught? Well, my guest today is Dr. Rob Downey, and he started his career in conventional medicine. He was writing prescriptions, following protocols, doing everything by the book, and then one patient's recovery changed everything. In today's episode, you're going to hear how that moment led him from prescriptions to purpose, and also what it means for you. Welcome to the Health with Hashimoto's podcast. This is where you will find clarity and simple, sustainable strategies to feel better. I want to help you figure out your root causes. My name is Esther Yunkin. I am a registered nurse. I spent about 17 years in the emergency department, and then I got sick and tired of putting Band-Aids on chronic things. I went back to school, and now I have been in holistic health education for about 10 years. I know how exhausting it is to live with fatigue, brain fog, and the ups and downs of Hashimoto's. And that is why I'm here. I'm here to cut through the confusion and to give you practical steps that support your body, calm your immune system, so that you can regain your energy and feel like yourself again. I am excited to have a guest for you today and to introduce you to Dr. Rob Downey. He is a board-certified family practice doctor. He is an IFM certified practitioner, and he has 21 years of experience as an attending physician and 15 years as a functional medicine provider. He is the founder of Seaworthy Functional Medicine, and it is a pioneer in responding to needs for better availability of functional medicine in the underserved areas of Alaska. So he knows that a little goes a long way when you are looking at health changes. Dr. Rob, thank you so much for being on the podcast. Tell listeners a little bit about yourself.
Thanks so much for having me. As we were getting ready today, we were talking about the bio, and now I'm in my 25th year as an attending, and I'll be entering my 20th year in functional medicine. So time really flies by. I had the privilege of interviewing Jeff Bland once, and he said, "Yeah, Institute for Functional Medicine, 30 years." And I thought, wow, that's just crazy that things have been around for a while now. But I'm in Alaska, and my practice has been in Montana and Alaska, and I've always worked for nonprofit hospitals and and for Native corporations, Alaska Native corporations. And so it's been really, really interesting in my career that most functional medicine clinics are sort of cash pay, standalone clinics, and mine has always been part of a hospital. Has always been a clinic as a part of a hospital. So I've learned a lot about how to have functional medicine be covered through insurance, because really the family practice visit is the same. It's a time-based high complexity visit. And I've gotten to serve a lot of people that wouldn't get served otherwise. In most instances, tribal health coverage or Medicaid or Medicare or insurance. A lot of patients in Alaska are insured. So there's always winners and losers in every practice, but having a functional medicine practice that serves people with insurance for those that don't have as many resources as the rest of us is something I've learned a lot from and been really proud of, and it's changed the shape of how I see things, because I get to see a lot of complexity. I get to see a lot of what works and what doesn't, and most of my patients don't have a lot of resources. So I also think of myself as a painter that's learned how to paint with fewer paints, or a guitar with fewer strings, or something like that, some kind of metaphor or analogy about how much yield there really is.
Right. Oh, I love that, because I lived in Alaska. I worked there and for 3 years. You're right. There are people without a lot of resources everywhere, but I feel like in Alaska, there are even more as a percentage. And even now, yesterday and this morning on Facebook, one of my friends in Alaska is like, I'm dealing with these health issues. I'm struggling. I don't know where to turn. And I need the native corporation to cover whatever I'm going to do. So hearing you say that you serve that population just brings such relief and comfort to my heart, knowing that there are people like you serving the population that I so deeply love. So thank you. Thank you for doing that.
Yeah. Thank you so much.
Yeah. So your story is interesting. And when I'm talking about doctors on the podcast, sometimes I love doctors. I've worked with so many. There are, of course, being human, there are some bad doctors. I have worked with some bad doctors. But for the most part, doctors go into medicine to help others. They have good hearts. They want to do good. And sometimes I feel like I give them a bad rap on the podcast because we're talking about, how to get deeper. And when your doctor isn't answering the questions, how do you do things? So let's start with your story back before you found functional medicine. Like, what prompted you to get into medicine? And
Mhm.
then tell us about finding functional medicine.
Great. Yeah, thanks for the opportunity.
Yeah.
And, so, yeah, I when I went into medicine, I had a family, a medical family, which often can be a disincentive. But I remember telling people when I applied to medical school, I just thought it was really important. I wasn't fired up about business, for example. I thought meaning's gonna have to really drive my work, and it was
Mhm.
just sort of the choice at hand. And so I leapt into medicine, and I really enjoyed the challenge, and I really enjoyed the service. But I remember from med school up through becoming an attending physician, being in north of the Arctic Circle, for a couple of years up until 2005, I remember thinking, "Wow, this is really great for some things and not so great for other things."
Yeah.
And I never articulated it though. It was just this sort of observational journey.
Mhm.
So conventional medicine's great for removing brain tumors, setting broken bones, killing bugs with drugs. And I would never want to be without those tools. But I saw two types of things happen before my functional medicine training. One was that I saw folks not be met in the moment.
Yeah.
And that wasn't even a functional medicine issue. I remember a patient that had to have part of her esophagus removed. And as the medical student, I rounded on her and she was writing on a chalkboard and she said, I didn't know the score going in.
Oh, no.
And I remember talking with her for an hour because a medical student's got an hour.
Right. Right.
But I thought this should have been the attending physician before the surgery.
Oh,
We should
absolutely.
not be hearing this. This is devastating. So part of my take was just we have to connect. And I kind of lucked out there because that's always it's always been part of my jam is connecting with people. So I end up getting this job. I dream of going back to Western Montana. I get a job, South Central Montana, and everything's wonderful. And it's an integrative clinic. And the only criteria to get the job are that I have to be open to integrative medicine. And we all think this is a great situation. And then I'm sitting in a patient room, and this woman comes to establish care with me. And she's probably 55, and she has psoriatic arthritis that's so severe. So, psoriasis arthritis, autoimmune arthritis. It's so severe that she has nearly disabling low back pain. The digits of her fingers, pardon me, her fingers have drifted off the hand bones by about 20 or 30 degrees. So, her
Oh,
hands are
no.
really deformed.
Yeah.
She's circumstantially depressed, not a depressive person. It's affecting her marriage. It's affecting her outlook because these immune drugs suppress the bone marrow. She's ending up with low white blood cell counts and recurrent pneumonia, and they're not suppressing the psoriasis. And so I say to her in good faith, "Oh, well, why are you seeing me?" And she says, "You're the integrative doctor. You're gonna change all this." And that's where I'm really proud also that I'm kind of a team-based person. I think I'm much more of a we than an I person. And so I'm also glad that I had the humility to say, "Oh, wow. Well, I know who you should see, but it's not me." And that sort of way of relating to things has been really important at many, many junctures in my career. So, our naturopathic doctor who's trained at Bastyr, Hilary Daly, had been doing it for a long time, had a great reputation with autoimmunity, and I said, "I'd really like to refer you to our naturopath." So I passed this same patient in the hallway about somewhere between 3 and 6 months later, and you know how when people get better, their posture gets upright and their skin gets nice and flat and their eyes get bright and their complexion is rosy? I mean,
Yeah.
it's the look of vitality,
Yeah.
and she has that. She's at ease in her body, clearly, and I say, "Wow, you look so different than the day we met. What happened?" And she said, "Oh, I'm so thankful for Dr. Daly. And I'm maybe 50, 75% better without drugs."
It's awesome.
And I said, "What did she do?" And she said, whole food plan that's anti-inflammatory and stress management and boswellia, bromelain, quercetin, probiotic, and I said, "And?"
Right?
She said, "No, that's it." And so I was talking to Dr. Daly in the break room, and I said, "What are you doing? How do you do it?" And she said, "The Institute for Functional Medicine teaches medical doctors to be like Bastyr-trained naturopaths because Jeff Bland and Joseph Pizzorno have this sort of common root type thing. Jeff Bland and Joseph Pizzorno founded Bastyr, and then Jeff Bland founded the Institute for Functional Medicine. So you're going to find the same principles there." And I just delightedly said, "Oh, well, if I get the training, will I understand what you do? You know, those moments in life?" And she said, "If you get this training, you'll do what I do."
What an invitation.
And yeah, and my mentor, who I dearly love and remain good friends with, she's a pretty thrifty person. And she said, "Rob, if you do the introductory class, I will fly to Fort Lauderdale with you and take the class with you to be your support team because that'll be so fun to freshen up my skills and be." And so we flew to Fort Lauderdale, and every night I just said,
Yeah.
head exploding emoji again in the best possible way. Yeah. And because you gave me the chance to talk about this, which I don't get to talk about very often, I'll never forget that David Jones, who it sort of is like a heart-based family practice doctor. He did a lot of the functional medicine framework around connecting with people, including the data, and collecting oneself, centering and grounding oneself before going into the visit. And he was there, and he did the intro, and he said, and this is true. You can really hunt this down. If you wear a pair of glasses that turn everything upside down for a period of weeks, when you take them off, your brain will flip everything.
Yeah.
And then over a period of days, it'll flip back. And he said, "Bad news, everyone. You're all wearing upside down glasses. We're going to take them off this week and you're going to be really disoriented." But that's what your conventional training has done is it's made the world inverse to what's actually happening in terms of the complex chronic backstory to people who have complex chronic problems and root cause medicine. And it was just the perfect way for me to understand the disorientation and psychic pressure I was feeling around, wow, there's a whole nother world here. And then
Right.
Institute for Functional Medicine said, hey, drugs matter, procedures matter. Somebody with Graves' disease who's in the ICU, we're not going to give them herbs. We're going to, suppress the thyroid storm. But it was just this whole extra dimension. And then because Institute for Functional Medicine says now you've just got a bigger toolbox, you need to learn how to use it elegantly. That's been my joy in getting to do that. And it's really deepened my compassion for my colleagues who you invoked, because what I'm so clear about, none of them have endorsed this, but I feel certain this is true. The actual reason there's such a pain point to getting into my kind of work is I had to let go of a bunch of things that I thought were gospel.
Yeah.
And in medical school and residency, essentially during the training, the trainees are kind of imprinted like goslings following Mama Goose. If you
Absolutely.
color outside the lines, you're going to hurt somebody.
Yep.
You must listen to us. You can't be a cowboy. You can't be freewheeling. And so the trouble is then there's a certain temperament, and for better or worse, I actually have that sort of half devoted student, half rebel temperament
That you need.
that positioned me to say, hey, what's I'm just going to pursue what's true. There's a bigger truth here. And I hadn't actually heard many other people invoke the Hippocratic Oath, but I ended up invoking that quite a bit, that once you know there's something better, you have a Hippocratic Oath obligation to manifest that. And I still believe that. So yeah, that's led to just an incredible career, some real challenges. I would never, ever characterize myself as somebody who got everything right. I upset some people. I overstepped a few times. I got in over my head a few times, but that's medicine.
Right.
And
Right.
I mean,
And you're doing it with a Hippocratic oath in mind. You're
yeah,
always trying to do the best for the
yeah,
person in front of you.
yeah. And just being a pretty fierce person and pretty all in person. I mean, my successes have been because of that, I think. And And the times that I pushed the envelope a little too far, I mean, we would have never gotten into space if we didn't have test pilots.
That's
So, but
absolutely
every
true.
once in a while, the plane tumbles, the wing rips off. So,
Yes. It does happen.
anyhow, I'm happy with how I practice now because I learned a lot. I learned a lot very quickly about where the line is.
Okay.
So, yeah.
I love that visual of the glasses because I've heard that before, like that study, but applying it to this instance of when you were in medical school, you're putting on those glasses without even knowing it. And now
Yeah.
this is how you see the world. And now we're going to remove the glasses and everything is going to look upside down. What were
Yeah.
some of the biggest, like, most confusing things for you that you had to learn? This is actually true.
Gosh, there were a lot. When I met my mentor, I met her out in the street down in Hamilton, Montana, about an hour drive south of the clinic where we worked together. And she had a big naturopathic practice there. And she had 500 amber bottles in the back of her clinic that she had wildcrafted these botanicals
Wow.
and alcohol. She made her own tinctures and just this whole wow, there's all these plants and they're all back there and they all do something and this lady mixes them together. It sounds like alchemy.
Yeah.
But then down the road, then the active ingredient in turmeric is curcumin, and curcumin downregulates NF-kappa B, and NF-kappa B is the same master regulatory knob that's impacted by prednisone, so you get the downregulation without the side effects. So that's the mechanistic part, and then there's the art part, just our natural medicine playbook pages that these plants are, the gift of God or the gift of creator or the gift of goddess or the gift of Mother Earth.
Mhm.
So we have these multifaceted physiological cascades that are meant to be intimately entwined with these signaling systems from the earth, whether it's food or botanicals or to some degree nutraceuticals. And so it was just this wild, wonderful, beautiful journey. But the thing was, the patients were having these spectacular outcomes and they were deeply appreciative and it was very safe. And so actually what happened is my psychic pressure had to catch up with the outcomes because my mentor and I saw these patients together at the visits and the outcomes were just like the psoriatic arthritis case. They were out of proportion to expected or way out of proportion to expected
In a good way.
in a really good way. And so it was just so compelling how powerful this tool was. And it really, my heart of service was just compelled to just keep going. And then I guess the other thing that I was able to do is just say, oh, wow, there's things I didn't understand. And now that I do, I have to figure out how to internally reconcile all of them. And that's when I started talking to my colleagues and my patients about this does all fit together. And credit where it's due. That's what the Institute for Functional Medicine said the whole time. They said this all fits together. These are just more tools. So you turn a bolt with a wrench and you turn a screw with a screwdriver. And if you take one tool to the other thing, you don't get what you want.
Yeah.
So it's a neat chance they used to say re-enchant yourself with clinical medicine, Institute for Functional Medicine. That was their old motto. And it's enchanting because in the best possible way, there's some creativity and alchemy in the plans, but the science is so rigorous and the decision making is so discerning and so rigorous. And so it really is possible to do it all. And we never know where the cases are going to go because each case is just a tailored jacket made for that patient. And sometimes they think they're here for herbs and they end up seeing the surgeon. And sometimes they think they need a blood pressure drug and they end up on some CoQ10 and magnesium and mindfulness. We just never know what their
Right.
tailored jacket's going to look like.
Right. Because each person is unique.
Mhm.
Yes.
Yeah.
Yep. I remember you said when I was on your show, I think you said there's such a binary in a traditional medicine. Either you're sick or you're not. And that's not actually true. Like there's more to it. So when somebody comes to see you, let's say for Hashimoto's, since that's my podcast, how would you have seen that binary and what do you look at now instead?
Well, it's poignant to report that not only did I see it in a binary fashion, but that was who I was, and that's how I treated things up until 2005. That might have been part of my motivation too, is sort of atonement.
Yeah.
Once we know more, maybe with our kids, for example, those of us that have kids, if there's something in our parenting that wasn't optimal but well-intentioned, and then we know a better way to do it, part of why we really show up for that next level is this sensibility, "Oh, I could have done it better, but I didn't know."
Right. Yep.
And sort of hoping then that they'll give us grace for who we were before we leveled up. So I used to say to people, "Well, you don't, you know, I did the thing that I now am so critical of. I said to people, 'You're fine.'" There's a deep irony, of course, which your audience will appreciate, and
Yep.
Hashimoto's hypothyroidism is the perfect example. I said, "You're fine because your TSH is less than 5 or less than 5.5 or 6 or whatever it was when I was trained."
Mhm.
And so once the Institute for Functional Medicine came along and said, "It's not disease versus absence of disease. It's not that binary distinction. It's disease to optimal health, and there's a spectrum, and we're moving people here." Then what I realized was when I said to people they were fine, how deeply offensive that was, because they would have never come to see me if they felt fine.
Right.
And even more deeply, ironically, their numbers weren't fine, and I was the one that didn't know it.
Yeah.
So, very poignant. I would say the other thing is to do functional medicine as a physician, you have to be ready to be humbled, but just about everything that matters is humbling. I mean, not all the people who attain mastery level in their craft are humble people, but the process of learning and showing up and trying to attain mastery level is inherently humbling, I think, for everyone. So then fast forward, I would say to people, "Hey, this is what the Institute for Functional Medicine says. TSH optimal 0.4 to 2.5. Nice robust free T4, free T3, nice low reverse T3, thyroid antibodies as low as possible. Here's the lifestyle, non-drug dimensions. Here's the medication dimensions. Here's the degree to, unwed yourself from these bridging principles." And it was just so satisfying. And it was really satisfying to say to somebody whose TSH jumped up to 17, "Hey, the thyroid supplement's not gonna get you back under 2.5. This is a dosing issue." And I have people drifting in and out of my practice all the time because I do what Sachin Patel recommends functional medicine doctors do. I polarize my audience. And now
Okay.
my true north is I just say, "This is what I would do for me or my family."
Yep.
And it's very easy then. I don't struggle with my message because I've seen what works and
Yes.
kind of it's kind of easy to be who I am and know that a bunch of folks are gonna benefit and actually know that it's good that they not be with me. If they don't want to deploy the things that I have to offer them, then they definitely should be seeing somebody else, not in a bad way. I hope a good way.
Right. You have to be having a good relationship with your providing physician or nurse practitioner. Like, if you don't have that trust, it's not a good fit.
Yeah, and I would say the pound what's shocking to me, Esther, is just the number of people who say the first visit, they just say, "This is the first time I've ever been heard."
Oh,
And I
it
think,
breaks my
"Wow."
heart and also
I
makes me
think
grateful for you.
I think, "Wow, ouch." And I do know I mean, a bunch of my colleagues are hearing their patients too. I think what we're not we do a long intake visit, and so it has a very relaxed feeling,
Yeah.
and very much the vibe on the front end is just like meeting somebody for coffee. "Hey, how are you doing? How was your day? How was the drive? How's your kid? How'd the softball game go?" Most folks are just ready to just jump right in. "It's fine. My shoulder hurts. I'm coughing. I'm tired. I'm
Right.
insomniac. I'm anxious." But just that whole sort of open-ended first salvo, just fully exhausting itself and just connecting to that. "Well, what about this? What about that? Anything else?" Also, I end every single visit, "Do you have any questions or concerns I didn't address?" And then they say, "Oh, yeah, there's these 7 other things I wanted to do." And I say, "Okay, we will get those into the note, or I'll have them give them to my team or put it on the portal, and we'll get to it next time." But I think when we do it well, we're really correcting, like, just a fundamental, we're going back to the way people have related for hundreds or thousands of years.
Mhm.
I think part of our genetic sort of birthright or physiologic, who we are-ness is just to connect in an open-ended fashion. Cause I think that's probably what hunter-gatherers did.
Right.
How was the hunt? Where'd you see the berries? What were the leaves doing? What was the weather? What was the day like? How'd you feel when you woke up? You were 2 days out from camp. How'd that go? Well, we saw this and we saw that, and then we collected such and such, and then so and so twisted their ankle, or winter, right? Telling the stories of who we are and how we relate to something bigger than ourselves. So I think there's a universal resonant state we're tapping when we just literally hear the deep listening. That's probably the right term. I think they were heard in other settings, but I think what they're actually saying, this is the first time I've ever had a physician manifest deep listening.
Yeah. Yeah. Because a traditional clinic, you don't have time. Like, you
Yeah,
are restricted. The insurance companies or clinic
yeah.
managers, like, you gotta push them through.
And there's another irony here, it's the most efficient, because I did deep listening before I got the functional medicine training, just intuitively, and I'd have these really complex folks, and I'd take an hour on my intakes or 45 minutes, something like that, pretty long, and long follow-up visits till we got them dialed in. And I remember I'd say to my complex patients after I'd known them for 6 months or a year, "Anything else? Nope, good to go." And then I'd be doing the note and think, "Oh, we managed their chronic kidney disease and their congestive heart failure and their hypertension and their high cholesterol and their depression and their insomnia and their fatigue." Wow. They didn't wanna they they didn't have anything more they wanted to address at the end of the visit. "No, I'm good. See ya."
Right.
So it's the most efficient too.
Yes, yes, it is. I remember when I was going back to school for holistic health education, one of the research papers I read, it said something about most physicians, if they listen to their patient and don't interrupt after, I think it was 120 seconds, they will be able to diagnose what's going on without any further testing. But most people interrupt after less than 10 seconds. And I put it into practice when I went into my patient's room in the ER. And even with that in my head, I still found myself, like, interrupting, so pressed for time. I'm like, "Okay, I'm to try just to listen. I'm gonna try to ask questions," and, of course, starting an IV while we're talking or whatever, but that deep listening, I think you're right. It is so integral for feeling heard, for feeling seen, for feeling like there is hope, and feeling like somebody actually knows what's going on and can do something about it. And it's just a level of connection. And then it, like you said, is so important for you and figuring out what's going on. So that
It's like cheating. It
right,
feels like cheating. "Oh, wow, the X-ray vision reveals, you know, what's happening again."
right.
I
It's
can't
like it's
imagine practicing without it.
yeah,
Yeah.
yes. So if somebody is currently seeing, like, a traditional physician who does not know about functional medicine, is there any advice that you would give them? How can they improve their care in that setting, or do they have to look outside and find a functional medicine doctor?
Probably the latter, because again, I think what's happening in the conventional setting is just that you you as the patient can pick up on it. When they say yes and no in a binary fashion, they think they're protecting you from harm. They think they're protecting you from folks that don't know what they're doing, and that's what they were trained. And I forgot to mention, just again from a point of compassion, if we were to think that a provider should start to endorse integrative, holistic, functional, we might need to remind ourselves that then their confidence to even treat a cold, I mean, they just may not it may not be psychologically fair to expect that they could.
Right,
So essentially, I think you have to gravitate to somebody who has the interest that this is the right thing to do to get onto the other side into this other toolbox. And then it becomes comfortable again. And it gets rid of a bunch of awkward stuff
right,
because it's such a tense, icky feeling, that they don't agree with you and they're trying to dissuade you. And patient often feels that the doctor is arrogant, which isn't necessarily the case. And the doctor often thinks the patient is non-compliant or whatever old-timey word we have for they're not doing what I want them to do. And I just think there needs to be that. There's quite a few very well-trained people in many domains now, not just IFM. Of course, that's the one I'm familiar with, but a bunch of bodies that do really excellent work, a bunch of fantastic naturopaths, a bunch of fantastically trained people in this lovely ether that you and I live in part of the time. And so I think they need to find somebody who's receptive.
Yeah. Yeah. Unfortunately, I think you're right. If they're seeking real answers, they're going to have to go out of the broken system.
One nice thing to do is when you go back to the conventional provider, the best way, the way the communities I've been part of have changed is the medical providers have heard from the patients. Wow, this made a huge difference. And I still do the conventional part.
Yeah.
I think that's the best. That's the best way to change the system is the patients have so much power.
Wow. That's huge. That's huge. I did not know that. I love that. So my listener, been listening to the whole conversation, fascinated. If there's one thing that he or she can take away from our conversation, what is the most important thing you want them to hear?
It's really important to be at peace
Mm.
because our immune system, our physiologic pathways, our digestion, etc., they're all built on the groundwork of us being at peace. And we don't live in a world right now that feels like that's the default response to the world we live in, to be at ease. But those are all the default switches in our physiology that we need to be healthy and have low or no autoimmunity and vibrant thyroid health in a native fashion with no drugs, no testing, no nothing, no supplements. I mean, all the software and hardware is just sitting there. It's all turned on from a state of peace.
Yeah.
So whatever your state of peace is, whatever you need to be at peace, it's probably the most important functional medicine question there is. And thankfully, again, everybody's tailored jacket, they actually know in their heart what that thing or those things plural are. So it's more about just the courage of whether or not they're going to choose to be at peace.
Yes. Yes. And that's something that you don't have to go see a doctor to figure out. Everybody can do that for themselves. What will help me be at peace?
Yeah. Yeah. The price point is right. The price point is courage.
Yeah. Very true. Dr. Rob, thank you so much for taking some time out of your day to be on the Health with Hashimoto's podcast. Where can my listeners find you?
seaworthymed.com. So you can check out Esther there. She's on the Field Notes podcast. It's just a tab you could click on. Don't check out the blog. It's old and dusty. You won't find much there. We probably need to take it down. Podcast, on the other hand, is really vibrant and has people like Esther. And it just would really mean a lot if there's value there to do what all content creators encourage you to do. It does actually matter. Like it, subscribe, share it, because somebody needs, if you're benefiting from this, somebody else needs it. And in the digital ether, the only way you can get it to them is to feed the algorithm in a good way. So seaworthymed.com, the podcast tab.
Awesome. I will have that link down in the show notes. Thank you again for coming on the podcast. This podcast is for informational and educational purposes only. Please discuss any changes with your trusted healthcare provider. To take your next step, join our school community and explore the courses available there. You do not have to figure your health out alone. So that is school, SKOOL.com, and it is the Health with Hashimoto's community. I'll see you next time on the Health with Hashimoto's podcast.